Hi everybody, thank you for joining me again today for another live session with me, Rix. Now, if you joined me last week, we talked about exercise and pregnancy, how to keep fit, things that you can do when you're pregnant for your first trimester, second and third trimester. Today, we're going to be looking at what can you do after you have given birth. Now, a lot of people say, Rika, I've gained so much weight during my pregnancy. I want to lose it now. What can I do? What are the exercises that you recommend? Let's take a step back and just look at things that you need to understand when you've given birth. Okay, so there's a couple of things that I want you guys to think of. You can either have a normal birth, right, or a C-section where there's actually a surgery needed to deliver. Okay, now depending on which type of birth you've had, that will affect when you can start exercising and the type of exercises that you need to start with. Okay, so it's very normal to gain weight during pregnancy, and to be on the healthy side, you'd always want to make sure you gain weight as the baby just grows. Usually when we have excess weight because we're eating too much or we're enjoying all the cravings, that's when we have a lot of weight to lose. Once you've given birth, you will be losing that weight that your baby had or was inside your belly, and that weight's gonna go instantly. And as you start breastfeeding and as you start taking care of your baby, carrying your baby, you will see that you'll naturally start to lose weight. Okay, now you're gonna say, Barika, I want more. Let me know what else I need to do. Okay, the thing is, when you have a baby inside your belly, your abdominal muscles stretch out as well. Okay, so the abdominal muscles start to get a little weaker because they do stretch out. So once you've given birth, sometimes they have a tendency to be stretched or even overstretched. So the key thing after giving birth is to be able to strengthen those core muscles again. Now remember, before you start exercising again, whether you've given birth normally or had a C-section, please get your doctor's clearance, because your doctor will be able to tell you if everything is good to go. Now, if you've given birth normally, we'd still suggest that you take about, say, 6 to 8 weeks before you get back into a good normal regimen of exercise, okay? However, there are some people that after they've given birth, they're ready to move in the next few days. So you can start exercising with light movements when you feel you're ready, okay? If you've had a C-section, on the other hand, because it's a main surgery, you have to remember that you need to give your body time to heal. And everybody heals at different rates, depending on your age as well, and depending on how good your body is now, or how healthy your body is as well. So we would roughly recommend that within 4 to 6 weeks, for those that feel strong and think that they can move, yes, you can start with light movements and walking. But usually we say 6 to 8 weeks before you do anything and you've gotten your doctor's clearance, okay? If you've had a C-section, it's very normal to feel really tight around where the cut was made. You'll feel tight. Sometimes you might feel loss of sensation or connection to your abdominal muscles. That's really, that's a normal thing, okay? So that's why it's really important to start moving slow to the range of motion that feels pain-free. If you start exercising and you feel pain or a pressure that doesn't feel right in your abdominal area, stop moving, right? So the best exercises to start getting into would be walking. You could also be going into swimming, right? Pilates and yoga are great things to get into because they will focus on letting you breathe and be more mindful about getting the core muscles involved, okay? Especially when you feel that you don't have that connection to your abdominal muscles. Now, also, you may have heard of Kegel exercises, okay? What are Kegel exercises? Kegel exercises basically help your pelvic floor. Now, Rika, where is my pelvic floor? Okay, I want you guys to imagine like a drum, okay? The drum is inside your midsection, and that would be your transverse abdominis. Let's think about a corset. You wear your corset to tighten your midsection. That's what your transverse abdominis does, okay? Underneath that, you have your pelvic floor, and your pelvic floor holds all of your internal organs up, right? And above that is your diaphragm, Okay, so that's all below your ribs, guys. Now, what happens is, guys, the pelvic floor weakens, and especially after you've given birth, they may feel loose. So you may feel incontinent where you can't hold your pee in. So you need to do Kegel exercises to help strengthen your pelvic floor. Now, how do you know your pelvic floor is contracting? So just imagine, or when you try to hold your pee in because the bathroom is not there, you're waiting in a long line, that's your pelvic floor in action, guys. That's actually contracting your pelvic floor. Now, when you do it mindfully, you would like to think of contracting. So if you're watching this and you're trying it now, when you contract your pelvic floor, you're going to feel a little bit of a pull or a lift. Some say, imagine lifting up a tissue, but I would like you to think of an elevator. Okay, try to contract it as much as you can, and your elevator goes all the way up to the top floor, the 5th floor, right? What we want you to try to do is try to get that contraction to go up to the 3rd floor probably, and hold it for about 8 counts and let go. Try it again for another 8 to 12 times. If you get to do this 8 to 12 times at least twice a day, you're on your way to slowly strengthening your pelvic floor muscles again. Now, once they start working well and get healthy, eventually you don't even need to think about getting your pelvic floor muscles to work. The transverse abdominis, on the other hand, its main job is to keep everything intact, and it keeps your body, safe. Yeah, and your abdominal muscles on top of it, your 6 packs that you see, is there to keep your body upright as well. Now, what you want to be avoiding are doing crunches, a lot of twisting movements, and even planks or push-ups on the floor for the first 6 to 8 weeks, and actually when you start getting into working out, because you just don't want to put too much pressure onto the healing part of the C-section. Okay, so think of all these things. Kegel exercises are quite easy to do. We suggest that you do it seated, and then try doing it when you're standing as well. Just don't look suspicious. You can also do it when you're lying down, and so that it just makes you realize how your pelvic floor can be working in different positions. Okay, there's also going to be some things that are quite common to women, especially those who have twins or have been really big during pregnancy, and we call it diastasis recti. Diastasis recti. This is where your right side abdominal and your left side abdominals actually separate, just to be able to let that belly stretch out. Okay, and it's something that can be worked on, and you can do exercises to strengthen that, but we suggest that you also work with a professional that could help you actually and guide you to make sure you're doing the right exercises. And the cool thing is, if you guys are based in Manila, in the Philippines, or actually anywhere, I have a very good friend. Her name's Mindy Lagdameo, and she is actually specializing in working with moms who have just given birth and are wanting to actually start working on losing weight, most especially those who had diastasis recti, right? So you can find her at mamamindyfit.com. Check her out. I'll say that again. It's mamamindyfit.com, and she's got an ebook about it as well that you can get, so you guys can actually have a great guide. After this, if you want to ask me more questions about how you can get in touch with her, send me a message and we'll get you linked, right? Now, going back to exercises that you can do while you're at home. Okay, so breathing. Breathing is really great to be doing. Now, it's not just a you don't want to be breathing or hyperventilating that way. You want to be taking deep belly breaths and being mindful about inhaling nice and deep to spread the rib cage. So try that with me. Inhale. And as you exhale, a nice long blow through your pursed lips. Now, blowing through pursed lips, guys, like you're blowing candles or bubbles, helps engage the abdominal muscles a little bit more. So let's try that again. You inhale through your nose, and as you exhale through your mouth, which is through pursed lips. This helps you guys engage your abdominal muscles just a little bit more, okay? Now, in terms of movement, you want to be doing things that do not make you crunch, right? So if you think of it, am I allowed to do squats? Yes, you can, but we'd say stay with body weight And you can use a chair as a guide. So if you're sitting on a chair, you can stand up from the chair and sit down till you tap the chair a little bit with your bum and then stand up again. It just gives you a guide for your movement. Because remember, after you've given birth, your body is still trying to get used to that loss of center of gravity again because the weight is no longer there. So give your body time to find that coordination through movement again. Okay, and remember last time I mentioned that you have a hormone called relaxin that is released in your body in preparation for childbirth. Well, guess what, ladies? You will still have relaxin being sent out in your body while you're still breastfeeding. Okay, relaxin stays in your body till up to 4 months. 4 months until you stop, after stopping breastfeeding. So if you're constantly still breastfeeding, relaxin is still in your body. So again, be mindful of movements, be mindful of not going into too big a range of motion right away, because again, your joints can be moving more, but it may not necessarily be safe. So start with very small movements until you feel comfortable. Okay, so the next thing I want you to think about to strengthen the sides of your core, right, is doing a side plank. Now, a side plank, we'd make you guys do it on your elbow and forearm and on your knees. Now, don't worry if you can't picture it in your head. After this video, I'm going to be posting some pictures about the different exercises that you can do to actually start doing this at home, okay? So, a side plank is great for working the core in terms of your obliques, but it also makes you be a bit more aware of where your body is in space, getting your abductors to be working as well. Your abductors are right by the side of your thighs, or your hips, sorry. Okay? Another thing that might be great to do are wall push-ups. Hey, wall push-ups. Because when you get down on the floor, and when you get down into a plank, at some point, your core is not strong enough yet to be stable for you. So a wall push-up, maybe with a challenge of having one foot slightly off the ground, will help you challenge your core and hip stability in a slowly or a gentle manner, okay? And the next thing, you might also want to try to do lunges. Now, when we say lunges or a split squat, be stable. Hold on to a wall or a chair and set one foot forward. And then when you lunge down and up, you just want to be in a very, very controlled manner to get those legs moving, the whole body working together. Okay, so when we do exercises, guys, always remember it needs to be pain-free, right? It also has to be something that you're comfortable to do. Okay, now the last thing I'd recommend you guys to do in terms of an exercise is a wall sit, okay? Wall sit means your back is up against the wall, your feet are slightly forward of you, and you just go down and sit like you're sitting on an imaginary chair. Why is this exercise so good? The thing is, it's a full body isometric exercise. When we say isometric, there's no change in muscle length, so you're not moving, but there's full body tension. And so the core is switched on and you're carrying your own body weight. This is a great way to get your legs in shape, to get your hamstrings, your glutes, to get your core on fire, and without having to lift weights. Now, if you're a gym fanatic and you want to get back into the weights, Rika, can I lift weights? We don't necessarily recommend that you carry weights that are heavier than your actual baby. If your baby weighs, let's say, 6-8 pounds, try not to carry anything more than that, right? And eventually, after 8 weeks, you can slowly then start to carry a bit more, okay? So, walking is going to be great. Swimming will be great. Getting into a Pilates class or a yoga class will be awesome as well, as long as you are mindful of your own movement. And hey, if you feel pain or pressure that doesn't feel right, it's okay to stop. Let your instructor know. Let your doctor know as well. Go to a professional to find out what more they can do for you. And again, check out mamamindyfit.com because you're going to find a lot of great programs there. And she does online and actual personal training as well in the Philippines. So check it out. And yeah, so I hope this little talk helps you understand that yes, you can work out after you've given birth. You need to get your doctor's clearance. Give yourself about 6 to 8 weeks to get your body feeling a lot better and ready to move. And you should be fine. Of course, there's a lot more you can do, but these are the basics to get you started, okay? So watch out for the pictures I'm going to be posting for the exercises I mentioned. And these are some things that you can start doing. And again, if you have any questions, please let me know. I'd love to hear your questions or your feedback or experiences. And if there's anything else you guys want me to discuss, let me know and I'll try to get to it. So thank you again for joining me today, and have a beautiful, beautiful weekend. Bye.